Centers. Dr. Jyoti Bajpai, Lead Medical and Precision Oncology at Apollo Cancer Centers, Mumbai and Maharashtra region. Please, I welcome you all to the dais. Anild'cruz. He is a renowned expert in the field of oncology, and it is an honor for him to share his insights with us today. D'Cruz, sir, the floor is yours.
Anild'cruz, as she said, I'm Director of Oncology at the Apollo Hospitals. I used to be the Director at the Tata Memorial Hospital. I'm a surgical oncologist. I specialize in head and neck. But apart from my clinical work, I've also been an administrator and committed to the cause of cancer control. I was the first Indian to head the Union International for Cancer Control, which is the largest cancer control body based in Geneva. I'm the immediate past president, and that's why I'm here today to speak to you. Because apart from our care, we need to do a lot to improve outcomes for our patients. First, let me tell you a little bit about our hospital. When I joined the Apollo, and the Apollo chain is well known to all of you all, it's the largest private healthcare provider in the country. We have more than 10,000 beds across the country and in some international places, 72 hospitals and about 20 dedicated cancer care units. But when I took over, or I came and joined Apollo as the director, I came with just one aim: to help improve the outcomes of our cancer patients. And how do we do this? All of us treat cancer. There's so many hospitals that treat cancers. People in your families would have cancer, you'll have taken them to numerous hospitals. But you improve outcomes by practicing 2 or 3 very simple things. You have to have tumor boards where joint clinicians make a decision and it's not made by one. We do evidence-based practice. That means what literature says you must do, and it's not what I feel is correct. And focus on dedicated areas. And that is the change we are trying to make at Apollo. And towards that, the third point about making a change in focused areas, that's why we are here today, to launch this rare cancer clinic. What are rare cancers? Dr. Jyoti, who is our specialist and joined us, Jyoti also was a senior professor at the Tata Memorial Hospital, and when we had this vision to start this rare cancer, we invited her to join us. So we have good expertise to launch it. The technicalities of rare cancers, she will share with you, and we've got 2 or 3 of our patients to share their testimony with you. But quickly let me tell you, if you look at it, all cancers we count per 100,000 cases. A rare cancer is something that's less than 6 per 100,000. The definition varies, so it's rare in its occurrence. Some examples of this is, say, hemangioendothelioma, which is very, very technical, a blood vessel cancer. That is a rare cancer. There could also be common cancers occurring in different people, a special population. Breast cancer is the #1 cancer worldwide. But breast cancer in a male is a rare cancer. Now, what is the problem of these rare cancers? Because they are so rare and there is no screening program, they are detected late. For cervical cancer, we have pap smear. For breast cancer, we have mammogram, but no one will suspect that a male can have breast cancer, so the patient presents late. So that is a problem of this. And second, because it is rare, there is not enough strong evidence to treat. So everybody treats these cancers differently. And our quest at Apollo is to have this rare cancer unit where we can create awareness. We need your support for that. People have a dedicated place to come for care, and we can do fine treatment such as molecular testing, genetic testing, which is a part of rare cancers. So with these few words, I'll hand over back to the organizers and maybe Jyoti to take over and give you all a few more technicalities. At the end, we can have question answers, and I'll be very happy to answer whatever questions the press has. Thank you.
To provide, can we have a dim light? Oncology, and to improve their quality of life through personalized treatment plans. When we say personalized treatment plans, because as I said that level 1 evidence doesn't exist for these cancers, because we cannot do, or there is a lot of difficulty in conducting randomized trials which leads to the level 1 evidence in oncology. So the evidence is patchy. Most of the time depends upon the expert's opinion, own experiences, some retrospective, prospective databases to understand what would be the best for this particular patient. So there is the role of personalized therapies and precision treatment. So in Apollo, we are doing this rare cancer, challenging situations clinic, as well as simultaneously we are working on precision therapies. And this precision therapy essentially overlap these rare cancer clinics because there are majority of time only a handful of options which are available, and many times we need to do this molecular analysis, genomic analysis, wherein we found from multi-gene panels that what are the specific targets which can be tameable, which can be druggable in these particular tumor tissues or liquid biopsies which are there, and how best we can target. We also work for combinatorial approaches for these cancers so that we can offer the best for our patients. What makes us unique in this particular respect? Expert team. So our specialists are the global leaders for the treatment of rare cancer. For these rare cancers and challenging situations in oncology. We also have cutting edge technology. We are quaternary hospital. We are having specialized care for surgical, for radiation, for medical oncology and a precision oncology kind of treatments, and our diagnostics as well. So we use the latest technology for accurate diagnosis and effective treatments, and majority of our treatment, rather I would say all of our treatment are multidisciplinary treatment based, so that the many brains storm together to get the best benefit for our patients. Remember, in oncology, the first plan is the best plan, and that is the best chance for cure. It is even more true for a rare or ultra-rare cancers. Patient-centered care, so we tailor our approach to each individual, offering comprehensive support and truly personalized care. So oncology is not only treating a tumor or cancer, it is essentially offering a holistic care. And we are treating a patient as a whole and also their families. There is a lot of psychosocial issues, there are a lot of other challenges which we face. Couple of my patients are here which are associated with me since a while, and they will also share their experiences. So it really requires a complete village to treat such challenging cases, and that's where we are unique, that in Apollo hospitals we are offering this kind of holistic and multidisciplinary based personalized treatment plans for these rare and ultra-rare cancers. I will give you certain examples of rare cancers. So as Dr. D'Cruz mentioned, there are two varieties of rarity or challenging situations. So one, by virtue of being rare histologies, per se their occurrences are very, very less. But again, remember that individually they are very rare, they are very few. But when they put together, because there are essentially more than 200 types of rare cancers, even more and more coming into WHO book of pathology every time. So together they encompasses around 20%, which is comparable to the disease burden of any common cancer like lung cancer or breast cancer or gynecological cancers. So we should not be neglecting these. These are often forgotten cancers for long, because people, policies, authorities, everybody concentrate on treating common cancers. But when we put these all rare cancers into one basket, they also have the similar burden of around 20%, which is comparable to any common cancer in this world or in India. So these are bone soft tissue sarcomas, including desmoid tumors, which fall into the category of intermediate. Skin cancers like melanoma or non-melanoma variety of skin cancers. Pregnancy associated cancers, very, very challenging. So not only rare, but extremely challenging, because we are having responsibility to not only taking care of mother's oncologic outcomes, but simultaneously a fetal health, obstetrical outcomes as well. Then cancers in sexual minority populations like LGBTQ plus populations. So these cancers are extremely rare and challenging. Often they are misdiagnosed or not diagnosed because a lot of stigma which we are having in the society. So we are having this first of its initiative in our hospital to treat these cancers, to provide a safe space for these population, because if there is a problem, we have to have a solution. Then neuroendocrine tumors, hereditary and familial cancers. Again, majority of the cancers, they are sporadic, or they just happen, they are having, a propensity to occur in anybody. But 5 to 10% of the cancers can be hereditary, so they run in families. There is pretty much challenging thing to diagnose them appropriately, and once they get diagnosed with certain mutation abnormalities, to have them counseled well, because there is complete family cascade which begins. So it is extremely challenging for the particular person, for the family, and we are establishing this kind of care pathway also in our hospital, so that we can provide a holistic care with multidisciplinary ways, people including the genetic counselors and other stakeholders becomes available. So it also becomes a chronic disease, and as these patients survive more, there are propensity to develop more and more cancers. Now we are facing this burden that many HIV positive patients, although they are surviving for longer periods, but they are presenting to us with cancers. Again, this is a very challenging situations in these patients with different kind of drugs going on, different kind of immunity status, very challenging. We are focusing to give care to these patients. Patients on chronic steroid therapies for any reason, maybe there are some respiratory conditions, maybe some other immune related conditions, but if they need to take prolonged steroid, it becomes pretty challenging to treat them if they develop any cancer. This is also one of the niche area we are focusing. Patient with autoimmunity. Again, because immunotherapy has come in a long way, patients with pre-existing autoimmune conditions can be pretty challenging to offer the similar kind of drugs and similar dosages. We need to develop a very precise protocol for them. This is again a niche area which we are focusing. Patient with comorbidities and polypill therapies. 3/4 of the population in India is diabetic, either frank or masked. Whenever we do an opportunistic screening, we find the blood sugar levels are either borderline or frankly in diabetic range. So these patients with hypertension, patients with cardiac condition, patients with neurological condition, you all know that these are the patients which are in our family, each one having some or the other disease in their plate. So if these disease burden are there, it becomes challenging to give them similar kind of garden variety treatment. Again, they require precision care, and where we focus among the challenging situations in oncology. And comments also. So no age is exempt actually. Consult experts to discover the best benefit for you. Early detection is the key for success, and we should motivate people to come forward well within time. This is towards the end, and we will be open to all the questions. So I really extend our heartfelt thanks to entire Apollo team, including patients and caregivers who are dedicated to advancing care in the rare cancer space. I really want to thank the entire national and international community, the societies. Many of the societies are doing a great work. I would like to put into words about European Society of Medical Oncology, ESMO. So I am a core committee member for ESMO in couple of tracks, and especially the rare cancer ESMO Asia mission. I am an integral part and trying to develop this care from Europe, Asia together. There is also a Eurochem, which is again a body which is working to improve rare cancer care. We had started an international rare cancer initiative also with these bodies. There is a lot of work which is happening in ASCO, and recently in LGBTQ plus care under the diversity force, I am included as one of the caregiver who can practice these kind of things and give directions to these niche area patients. So, एक पत्थर तो तबीयत से उछालो यार. Thank you very much.
Thank you, Dr. Jyoti. That was extremely informative and simple enough for all of us to understand also. Next, I request Mr. Arunesh to please give a token of appreciation. Next, I would like to call upon Ms. Namrata Kohli. Next, I would like to call Ms. of Pregnancy Associated Cancer. Next, Mr. Krishna Prasad, again a rare sarcoma case. He will be represented by his wife, Dr. Uma. They will be joining us virtually. Hello, Dr. Uma. There is a short audio sharing experience of his journey by Mr. Krishna Prasad. Can we please have the audio?
And a geotechnical engineer by profession, basically from Mysore and an IIT Bombay alumni. From 20 years working in a private company in Malaysia, I am healthy from childhood, excellent in studies and a hard-working person. A family man with loving wife and 2 amazing children. I am vegetarian, non-smoker, not alcoholic, spiritual and good at financial medical insurance planning. Now let me tell about my journey after diagnosed with cancer. Unfortunately, my cancer was diagnosed incidentally in 2023 during a general health screening. I was shocked and I could not believe it in the first place as I was asymptomatic. But I did not delay in further tests, and the result was retroperitoneal liposarcoma, which is a rare type of cancer. Sarcoma is a rare type of cancer that develops from the body's connective tissues, such as fat, muscle, blood vessels, and fibrous tissue. About 20% of sarcomas develop in the back of the abdomen, also known as the retroperitoneum next to the kidneys. Now a short brief about treatment. I underwent an open type surgery, which is the gold standard treatment for RPS. Having discussions with different medical oncologists, I came to know that post-operative radiotherapy or chemotherapy will not give good benefits for the type of rare cancer I have. So, with my family support, I followed active surveillance method, which includes periodic follow-up scans. Now let me talk about follow-up scans and recurrences. During one of my follow-up scans, I was diagnosed with local recurrence and second surgery was conducted within 10 months of first surgery in early 2024. Again, after 3 months of surgery, my PET CT scan showed a local recurrence and a metastatic lung nodule. This time, my condition was not operable at all. At this time, I seriously thought of consulting a medical oncologist who specializes in sarcoma and has very good experience. That's how I came for treatment at Apollo Navi Mumbai from Mysore. Dr. Jyoti Vajpayee's name was suggested by UK sarcoma specialist Dr. Beatrice Siddle. I studied the papers published by Dr. Jyoti Vajpayee and understood her high quality expertise and experience in understanding and dealing with patients having rare cancers. Dr. Jyoti Vajpayee's expertise extends to managing cancer in complex scenarios, and her method of approach to my comorbidity condition is highly commendable. Dr. Jyoti Bajpai not only has excellent command over her passion and field of expertise, but has an excellent team of multidisciplinary departments, which is very necessary for treatment of rare cancers like sarcoma. Within 3 weeks of my diagnosis, I underwent SPRT treatment for my lung. Since 2 months, I am on target therapy for my local retroperitoneal region recurrence, and so far there is no side effects. I resumed my work at Malaysia and my quality of life is very normal. Lastly, I like to wish Dr. Jyoti all the success for her initiative in developing Rare Care Clinic. I like to recommend this clinic to others who are in search of good guidance and treatment for rare cancer. I am sure that the center which develops under Dr. Jyoti Bajpai's leadership will have an excellent multidisciplinary team who delivers medically advanced treatment to patients and support to their families, and they will be the chief educators of healthcare professionals and the public. I wish that the center will grow into an excellent center for rare cancers in a local, regional and national levels, having an impact that goes well beyond its own walls into the communities it serves directly and by the general knowledge it creates into the world at large. Lastly, some inspiring words as Joel Sigel say, cancer changes your life often for the better. You learn what is important, you learn to prioritize, you learn not to waste your time, you tell people you love them. Have a great day all of you, and thanks for giving me a chance to share my experience. Thank you all. Bye.
Yes, sir, we can hear.
Okay, can I speak now? Hello. Thank you very much, first of all, for giving me this opportunity. And I am Pankaj Mathur. I live in Jaipur, and I am an IIT Delhi alumni. Work with UNICEF, United Nations Children's Fund on water and sanitation area. And my journey actually started with this disease in 2017 when I was first identified with a painless lump, which Dr. Jyoti said, which was identified by my right calf muscle, which was removed locally in one of the hospitals in Jaipur, and then it was identified as soft tissue sarcoma. Specifically, they identified as myofibroblastic sarcoma. Unfortunately, because the one thing which I really did very well in terms of following up on the after surgery scans with the disease every 3 months. So after 1 year and 3 months, I identified that there was a metastasis in form of two lung nodules in my lungs, and that was the time when I was actually recommended to Dr. Jyoti Bajpai by the local doctor. They said that she is the best, not just in the country but probably in the world, in terms of dealing with the soft tissue sarcoma and these kind of cases, because the doctor here was he was very open and very lovely in terms of accepting the fact that if we see a sarcoma patient in 10 days, probably Dr. Jyoti would be consulting almost 100 cases on a daily basis on such things. So first of all, I didn't even know that this is a rare case, and I knew throughout that yes, this is a rare disease, but when it was identified, I didn't know that this is a rare cancer. And in terms of my own cancer literacy, I came to know that this is really a rare cancer. And today there is a number associated to that when it was said that 6 in a million. So I really consider myself really one of the rarest ones to be there on the earth. But my journey with Dr. Jyoti really has been fantastic, and she has been so lovely in terms of interacting with me, with my family. When she said that the integrative care is important, so it's not just
Associated breast cancer in 2015. It was just 9 months of my marriage, not 9 months, I think close to 1 year of my marriage, and I got pregnant, and then I came to know that I have a cancer. It it was a very difficult situation, emotionally, mentally, physically, as well as you can understand the stress I have about my fetus, my baby. I came to know and I met Jyoti Vajpayee, and as ma'am mentioned, the treatment of cancer is not just a treatment of a patient, it's a holistic care. So care about patient, the baby which is inside me, my family, because they are going through so much of stress. She consulted, and it was a group of people, as ma'am mentioned, the oncologists, the surgeons, the radiotherapists. They consulted together to finalize my line of treatment, considering that I am a 6-month pregnant and they have to save my baby. I was continuously saying to ma'am that, ma'am, I don't want to start my treatment, just let me first deliver my baby. And she told me that you are diagnosed with 4-stage cancer. It's a very severe cancer, and I rest assured you that your baby will be fine. And this one statement that I assured you your baby will be fine gave me lots of strength. And I said, okay, I'll fight for cancer, I'll fight for my baby, and I am in the care of expert hand, so I should not worry about anything. So it was a tough journey, because it was, as ma'am mentioned, it was a rarest cancer. I have been through lots of difficulty during the treatment, but I had one faith that I am in safe hand. So myself as well as my baby will be safe. You won't believe that none of the gynecologists were ready to take my case. And ma'am suggested that consult to Dr. Vandana Bansal, and they both together, not only the cancer journey, my pregnancy journey, they made smooth. And I have a 8.5-year-old baby now. He is very well. He is in 4th standard. His name is Punya. So I feel like I am blessed with lots of Punya by doctors, by my family and everyone. And I really thanks ma'am. And today I am heading a department in one of the finest fintech company. I am having 30 people reporting to me, and all because of I can say that I was an expert hand, and man told me not to give up any time. One thing I would like to say that I would like to end my story with one thing, what I have followed. Fake it till you make it. So journey was tough, and I was always smiling that yeah, I'll be fine, my baby will be fine, and it will be a good journey, and I make it. You should be relaxed. I would say that consult your doctor every 6 months or a year, because I'm still in touch with ma'am. It's been 10 years now, and I'm living a healthy life, and I hope it will continue with expert care. And I wish all the patients don't give up any time. And if you are an expert hand, this will get cured soon. So thank you, ma'am. And you mentioned that the rarest care hospital. The case, when it is rare, I believe that very rarely a doctor is ready to take the case, because it's a rare case. Nobody wants to spoil their career if it is a rare. But ma'am, I think I hats off to her that she took my case, even make it happen, and I am happy now. Thank you, ma'am.
Welcome back, Mr. Pankaj and Dr. Uma.
Unless and until you struggle with that acceptance, your journey becomes really tough. Once you accept, you start your journey of that treatment. I also said the second month, many of my patients will, confirm this, that I tell them now complete it as a protocol. As there is a problem in everybody's life, there is a problem. First thing is acceptance, and then you complete it as a protocol, what is defined, what is in best interest of you. And a multidisciplinary based care treatment is the best chance for cure. As I said, cancer is something serious, because it really requires a rigorous kind of planning, treatment, and first diagnosis and first treatment is the best chance for cure. If we see some cases which are already handled in an appropriate manner, very sorry to say that, then chances of upstaging becomes very high, and then chances of cure really low. I will just give an example. In good biology breast cancer, if we detected on stage 1 or 2, there is a chance of 90% cure rates. While if we detect them in stage 4 because of negligence, inappropriate treatment in between, then chances become 10% or so, depending upon what biology and what stage they are. So there is a drastic, goes down. So get detected in time, accept it, complete your treatment the way it is planned in a multidisciplinary care where there is a expert hands available in a good reference center. Cancer is a diagnosis which should be handled in expert centers. That is also my strong message.
I'll just add to what Jyoti said. The most important thing I would tell a patient when they are diagnosed is no fear, no panic. Cancer is curable. You need to get the right treatment. Whatever stage, today we've got very, very good. Of course, as she said, the larger the tumor, probability of success drops. So we want early detection. Many cancer, and I'm telling you this after 35 years in the field, 40% of work I do is redo work, second opinion work. And I don't think any patient should be put through stress, emotional, psychological, financially, by not getting the best treatment first. So if I had to give one message, no fear, cancer is curable. Choose your right doctor, choose your right hospital, and go get the best treatment. And today, we have the best treatment in our country. There's no need of flying abroad. Everything is available here.
I agree with you. But what happens is often the local family physician at times are delayed in diagnosing or understanding the symptom. Diagnosis can happen at a later stage, but understanding the symptoms is very crucial at that level. So that could probably result in things going off.
So that's my request to all of you all in this room. We can give medical care, but creating awareness, we need you all. So I'd see you all in functions like this and then you all disappear. But we've got so many important days in the calendar and the year. We have World Cancer Day, World Tobacco Day, we have a month for breast cancer, we have a World Head and Neck Day. And I think you all need to put that news out in the press regularly. Awareness. You have awareness, people will prevent cancer, they'll come early and they'll get the right treatment. And we'll have many more survivors amongst all of us. Success stories, warriors like the 3 who are here and the 2 who are online.
Can I say something?
One more thing we do when it comes to the physician, family physician and all that. The expert like Dr. Cruz or Dr. Jyoti, they do involve family physician for awareness and their knowledge enhancement as well. So we are doing so many programs where we exchange that information to the clinicians where they can help to identify. As rightly said by Sir, role of press is important to communicate all this important is and make awareness.
Hello, we have a question over here. Let me just, because I want this connect. So one thing I would like to clear, you said that this press, they come in and buzz off. We don't buzz off, sir. We give best of the news to the...
You all are the most powerful media for whatever line it is, whether it is health, whether it is political, you all are the power. So we want your support. I am putting my hand of friendship out. Aapka sahyog chahiye. Constantly.
We are there, sir.
Thank you.
So my question to this man, when you were detected with this rare cancer, how did you approach all the doctors, because it's very difficult to get in touch with all these people and get to a specialized?
So I would say I myself was very lucky. My brother, he is a doctor, Dr. Saurabh, and he told me that Dr. Jyoti Vajpayee is one of the finest doctors in India or world. For me, she is best in universe. So we met her, and as ma'am mentioned, that it's a group, you can say it's a group, as she's oncologist, surgeons are there, radiologists are there. So they all discuss together that what should be the best line of treatment. So I can consider myself lucky that I met ma'am, and it was to whatever source. So I feel my brother was a source of meeting me, ma'am.
So again the question is over here, she was lucky to have a doctor in her family. The people who don't have these doctors, who don't have this kind of connections, how they should approach?
So like I said, no fear, no panic. If you make your decision in a hurry, then you may not make your correct decision. थोड़ी सी जानकारी करो, पूछताछ करो. Let me again make it in a very light way to you. If you have to buy a new mobile phone, you have to buy a new television in your house, you'll ask 50 people, you'll go to 50 showrooms. But for health, we don't give importance. We get panicky and we go to the first person and take treatment. So the message I want you all to carry is no panic, no fear. There are enough good people who can give good care, but go to the right specialist. My other very, very important message which I need the press to take. Today we have moved away from general treatment, general oncology to specialized care. At Apollo, we have one specialist, one department for each cancer. That drives excellence. It is well known, well published. We don't have general surgical oncologists. कि सुबह एक breast operation किया, शाम को एक abdomen किया, फिर एक head and neck किया. Many people are practicing that. At Apollo, we have changed that concept. We have specialists in gastrointestinal, head and neck, which I do. We have specialists in gynec cancers, urological cancers. That is important. So again, the message you have to go is go to a specialized center, and the decisions have to be tumor board. एक आदमी decision नहीं लेता. 3 डॉक्टर बैठते हैं, radiation, medical, surgical, then we take the decision. So these are the 2-3 points I can give you on the tips.
I want to second, sir, what he mentioned, that don't panic, and what man is saying, acceptance. I think once you accept and when you create that you don't have to panic, I think you will get the right guidance. So yeah, I was lucky enough that I was having one doctor in my family. But if you accept that you have a cancer and you will not panic, I think you will search wherever you want on internet, and there are so many places where you can see that what is the best hospital where you can find the expert, and then you can meet the right doctor. So I would second, sir, that don't panic, acceptance, and then yeah, you have to be very careful when you are choosing your doctor as well as the hospital for treatment.
Physical consultation. We also have something known as Apollo 24/7, which is a very powerful tool. You can take an online consultation. You can get convinced, see what we have to offer, and then the patient can come to the center. So we have got that. So I would urge everybody, always you can take a second opinion and do it online, be convinced, and then see the value add that is being given, feel confident and come across the treatment. And we have a state-of-art facility. I always tell people, and I'm not doing a marketing event, but I'm telling you very, very honestly, you have to be treated at a good center. If I blindfold you, take you to our Apollo center, open your blindfold, you'll think you're in a US hospital, and I worked in many hospitals. So you should go to a hospital that has multidisciplinary care. You should have good medical oncology, good radiation oncology, good surgical oncology. I might be a good surgeon, but if I operate in a nursing home or in a place that doesn't have radiation, the quality of care will not be the same.
Treatments are being offered based on the molecular diagnostics, the molecular profiling of a tumor. There are higher chances that we can, give them more advantage than side effects. And this is the way forward, and which we are practicing, especially in the segment of rare and ultra-rare care, where the standardized treatment options are very few.
Mr. Pankaj, you can speak now.
I have cancer. So first thing which actually really worked with me is that you need to count your blessings, that you may be having cancer now, but how your life has been. You have been always through some kind of blessings, but this is the tough time for which you need to go through. And then second thing is already pointed out that you need to do some kind of research at your level to identify that where the best doctors could sit, because and then it becomes really very important in case of rare cancers. Because as I already said in my case, in my first instance, when I had my first surgery, I didn't even know that this is so rare. But when there was a metastasis in lung, I really do a lot of research. I spoke with a lot of people. I went to a lot of, number of hospitals in Delhi, Mumbai, consulted people internationally, and then came to know that, the best doctor in India would be sitting there in Mumbai in form of Dr. Jyoti Bajpayee, and then go there and then follow with her your disease. As far as the patient's perspective is concerned, I also believe that the family support is really very, very important, because you cannot fight this battle alone. Your family has to be there with you, your doctors have to be there with you. And as Dr. Jyoti pointed out, Dr. D'Cruz pointed out, it's not just about one doctor. Team of doctors has to be there. There has to be a surgeon, there has to be an oncologist, there has to be a radiation specialist, there has to be a pain specialist in your team, so that when you really go through the pain during your treatment, people should be there to advise you the best, treatment out of that. And then last and most important thing with the patient's perspective is that, which I keep on, writing at many places. I've written it in my workplace, I've written it in my bedroom, everywhere. This too shall pass. It means, you had your best of your times in your life. It has passed. It has not remained over there. You are going through the difficult part of your life. You are going through a different disease, a difficult disease. This too shall pass, because you are in the best of the treatment. You are in best of your families. You are in best of your support systems, and you know that what is to be done. So this too shall pass. I have been fighting this disease for almost 7.5 years now, and but my association with the disease has always been like that. I have never considered it as my enemy, but because cancer cells are also part of your body. These are those naughty cells who have not been behaving the way you want them to behave, but they are always part of your body. The last thing which I actually wanted to point out is the importance of the follow-ups. I think one of the speakers said that your treatment is over and then you feel that you are a free bird now. No, please. You need to go for your regular follow-up PET scans or maybe CT scans as prescribed by your oncologist, your doctor. That's very important, because in my case, I fought it 4 times. 1 principal tumor and then 3 times metastatic tumors. And I was able to find out in an early stage, just because of the fact that I have been doing 3 months kind of follow-up with these with this kind of scans. And then I come to know that there is a trouble. And I really contact back Dr. Jyoti Bajpayee. Even if I have a normal report, I really contact back Dr. Jyoti Bajpayee and then ask her that what can we do for next 3 months. So this is the follow-up, which is really very, very vital, very, very important for a good quality of life, and also keep a bit of control over your body and disease, that what is happening with your body. But thank you very much, and then I'll take leave because I'm in Rome. As I already pointed out, that I made it a point that every time I clear this 3 months examination of mine, I try to celebrate. So this is just part of my celebration, that I'm with my family, in Europe, and then I'll come back in India next couple of days. So thank you very much for giving this opportunity, and I'll take leave now. Thank you very much.
Staff for launching this very good clinic. On behalf of caregivers and family members, I want to speak 1 or 2 sentences. As Pankaj said, rightly said, for the patient, family is a great support. So when family comes in the picture, during the hospital visits and treatment, we family also feel very happy that he's under somebody's care. But when they come back to house, or when they are with us, family, how we have to continue with the care what doctors has given. So this is, firstly, the family has to be very positive. And here I may sound a little bit weird, but I think with my experience, I'm a dancer and I'm a writer. So I do feel that personally I don't take it as a fight or a struggle or a war, because that follows the word win, defeat, which is the very negative for me. So I think managing the situation is the best word, so that I will get up every day. Oh, yesterday I managed it very well, My husband managed it very well. Today also we will do that. We will be very confident and we will move on in life. So we do go for a normal walks. We take a camera with us. We take photographs. We eat together. And one more thing is, when there is a I want to tell one thing here. Multidisciplinary means diet and nutrition also. So Dr. Jyoti has referred to us to Dr. Varsha Gore, who is there in the Apollo, and she gave us a diet chart. So this diet chart will start before your therapy and after your therapy and during your therapy. Three points. So you follow that, and what happens to your family, it will be a 360 degrees change. You will be eating so many vegetables and fruits, and you have a kind of restriction. Does it make you unhappy? No. What I am trying to do is, I will select the vegetables already in the chart, and I will go to each and every of the states of India, what they are preparing with that, so that I can prepare good food, nutritious food. I can try good recipes with all these restrictions. So this means I do not want to feel unhappy in this situation, so that I make myself more happy, and I will learn each day with my husband also.
Human papilloma virus, hepatitis, HIV. Lead a healthy lifestyle, avoid infections. Some of them you can take vaccines for. You will avoid 10 to 15% of cancers. The third commonest cause of cancer is faulty diet, obesity. We always think malnutrition causes malnutrition. Yes, you have to prevent malnutrition. But obesity, if a lady is more than 10-15% the weight for her age height, she runs the risk of 6 cancers, including breast cancer. And I put it very simply, ladies who have breast cancer on one side, if they keep their weight in check, the incidence on the opposite side is lower than people who are obese for their weight. So 3 simple things I've told you. Habits, infections, keep your weight in check. And what are the other 2 things that you can do is lead a healthy lifestyle by way of exercising. Today we call it NCDs, non-communicable diseases. Cancer is one of them, diabetes, hypertension, heart disease. Lead a good, do exercise so that you don't have a problem, be active. And lastly, a diet rich in vitamin A, C and E prevents against cancer. The brighter your vegetables and fruits are, it's called a chemo-preventive diet. And even if you have been diagnosed with a cancer and you take a chemo-preventive diet, it prevents against recurrence or a second cancer. These are all proven facts. So I think in brief, this is what I would like to say. Cancers. It's going to be at Geo World Garden in the first week of November, 8th to 10th.